Picture this. You're going about your day, maybe at home, in the car, or running errands, and out of nowhere, a sharp pain grips your chest. You're alone. No one's there to help. What do? Here's the reality. Heart attacks don't wait for the right time. They can strike anyone, anywhere, at any moment. According to the CDC, about 85,000 people in the US suffer a heart attack each year. The scariest part is that many happen when the person is alone. In that critical moment, every second counts. The actions you take could mean the difference between life and death. But don't panic. Today we're breaking down simple, life-saving steps you can follow if you ever face this terrifying scenario alone. These are steps that could save your life or someone else's. So stick around and leave a like and subscribe. It takes just a second, but it helps us reach more people with these essential health tips. And if you have any experiences or recommendations, I would love to read them in the comments. Whether you're at home, in the yard, or on the road, these practical steps can empower you to act swiftly. 1. Recognize symptoms quickly. Recognizing the symptoms of a heart attack quickly is your first line of defense in an emergency. Heart attacks often strike without warning, and knowing what to look for can save your life. While the classic symptom is intense chest pain, described as pressure, tightness, or burning, not all heart attacks present this way. Symptoms can vary, and sometimes they're milder than expected. Chest discomfort lasting more than a few minutes, especially if it spreads to the left arm, back, neck, jaw, or stomach, is a major red flag. Shortness of breath, even when you're not exerting yourself, is another critical warning sign. Additional symptoms include cold sweats, dizziness, nausea, or vomiting. Some people report extreme weakness, anxiety, or a feeling of impending doom. Pale or grayish skin can also indicate a serious issue. It's vital not to dismiss these signs as minor or temporary. Time is everything during a heart attack. Acting quickly can mean the difference between life and death. If you suspect you're experiencing a heart attack, don't hesitate. Recognizing the problem is the first step toward getting the help you need. Stay alert, stay informed, and take immediate action to protect your heart and your life. If you're going to take note of the symptoms quickly, comment "in the nick of time" to call 911 immediately. If you suspect you're having a heart attack, calling 911 or your country's emergency line immediately is the most crucial step you can take. Time is your greatest ally during a heart attack, and every minute without proper medical attention increases the damage to your heart. Dialing emergency services ensures that help is on its way and allows you to receive life-saving treatment as soon as possible. When you call 911, stay calm and clearly explain that you believe you're experiencing a heart attack. Provide your location and any relevant details about your symptoms. If possible, put the call on speakerphone so you can follow the dispatcher's instructions while keeping your hands free. Do not attempt to drive yourself to the hospital. Losing consciousness at the wheel can be dangerous for you and others on the road. Emergency responders are trained to provide immediate care upon arrival, such as administering oxygen, performing an EKG, or starting other critical treatments before you even reach the hospital. These actions can significantly improve your chances of survival and recovery. Remember, calling 911 is not overreacting. It's taking control of your health. In moments like this, acting quickly and decisively can make all the difference between life and death. Stay calm and make that call. If you're going to make this call in this situation, comment "emergency." 3. Rest in a safe position. If you suspect you're having a heart attack, finding a safe and comfortable position can help reduce strain on your heart and improve your chances of staying conscious until help arrives. The key is to conserve your energy and avoid unnecessary stress on your body. Start by sitting or lying down in a comfortable position. Ideally, you should elevate your head and upper body slightly by leaning against a wall or using pillows. This helps improve blood flow and reduces the effort your heart needs to pump blood. If you're standing or in an unsafe location such as a shower or outdoors, move slowly to a secure spot without exerting yourself. Avoid any activities that require physical effort, like climbing stairs or reaching for items. These actions can increase your heart's workload, further straining an already vulnerable system. Resting allows your body to use less oxygen and focus on stabilizing your condition. Remember, your priority is to minimize movement and keep calm while waiting for medical help to arrive. Stay as still as possible and focus on steady breathing. By resting in a safe position, you're giving your body the best chance to cope until professional care is available. Comment safe spot if you're going to try this step out. 4. Take aspirin if advised. In the critical moments of a heart attack, taking aspirin could potentially save your life, but only if you've been advised by a healthcare professional to do so in such situations. Aspirin acts as a mild blood thinner, helping to prevent existing clots from getting larger or new ones from forming. This can reduce further damage to your heart while you wait for medical assistance. If you suspect a heart attack and have aspirin available, chew a regular tablet, approximately 300 mils. Chewing allows it to be absorbed more quickly into your bloodstream through the oral tissues, speeding up its effectiveness. However, it's crucial to only take aspirin if you're not allergic to it or if your doctor has previously recommended its use during emergencies. Your priority should always be to call 911 first. If you have access to aspirin without putting yourself at risk or exerting unnecessary energy, then consider taking it. Remember, the focus is on minimizing stress and maximizing survival odds. While aspirin can help during a heart attack, it's not a substitute for professional medical treatment. Make sure to communicate to emergency responders if you've taken aspirin so they can adjust your care accordingly. Stay calm, stay safe, and let the professionals take over as soon as they arrive. If you're going to take aspirin, if advised, comment aspirin helps. 5. Stay calm and control your breathing. Remaining calm during a heart attack might feel impossible, but it's one of the most crucial things you can do to improve your chances of survival. Panic causes your heart rate and blood pressure to spike, putting additional strain on your already struggling heart. By staying calm and controlling your breathing, you help your body conserve energy and use oxygen more efficiently. Start by focusing on slow, deep breaths. Inhale through your nose for a count of 3, hold for a moment, and exhale slowly through your mouth. Repeat this process, concentrating on the rhythm of your breathing rather than the pain or fear you're experiencing. This simple technique can help stabilize your heart rate and keep you conscious while waiting for medical assistance. It's also helpful to use mental relaxation techniques. Focus on a fixed point in the room or repeat calming words or phrases to yourself. Shifting your attention away from the anxiety of the situation can reduce internal stress. Remember, staying calm doesn't mean ignoring the seriousness of the situation. It means taking control of it. These moments are critical, and your ability to manage your breathing and composure can significantly affect your body's response until help arrives. If you're going to try this method out, comment calm breathing. 6. Avoid exertion. During a heart attack, every second counts, and one of the most important steps to take is to avoid any unnecessary exertion. Moving around or engaging in physical activity can increase the demand for oxygen in your body, putting even more strain on your heart, which is already struggling. Every additional movement, no matter how small, can worsen the situation, increasing the risk of severe damage to your heart muscle. If you're standing, sit or lie down immediately. in a safe and comfortable position, preferably with your upper body slightly elevated. This reduces the effort needed for breathing and keeps your heart from overworking. Avoid trying to walk around, reach for distant objects, or climb stairs. If you're in a dangerous location, like the shower or outside, move to a safer spot only if absolutely necessary, but do so slowly and without exertion. It's essential to conserve as much energy as possible while waiting for medical help. The goal is to minimize physical strain on your body, allowing your heart to function with as little effort as possible. Remember, every minute matters. The less you exert yourself, the better your chances of reducing the damage to your heart. Stay as still as possible, keep your focus on breathing, and wait for emergency services to arrive. Comment staying still if you will try this method out regarding this situation. 7. Loosen tight clothing. During a heart attack, tight clothing can make it harder to breathe and increase discomfort. Loosen ties, collars, belts, or bras to improve circulation and allow for easier breathing. This simple step can help reduce the feeling of restriction and promote better oxygen flow to your body. By making yourself as comfortable as possible, you'll minimize unnecessary strain on your heart and body while waiting for emergency responders. Remember, your focus should be on staying calm, conserving energy, and creating an environment that supports your recovery. Small adjustments like this can make a significant difference in critical moments. Comment tight clothing if you're going to try this method out. 8. Don't eat or drink. If you suspect a heart attack, avoid eating or drinking anything. Consuming food or beverages could increase the risk of choking, especially if nausea or vomiting occurs. Your focus should be on staying conscious and minimizing any unnecessary strain on your body. Additionally, consuming food or drink might complicate emergency treatment if medical responders need to administer medications or perform procedures. Until professional help arrives, prioritize staying still, calm, and hydrated through controlled breathing. Now, by drinking water. This small but crucial step helps protect your airway and ensures your body is prepared for medical attention. If you're going to try this method out, comment, don't drink. 9. Monitor symptoms. During a heart attack, closely observing your symptoms can be life-saving. Watch for changes like worsening chest pain, new sensations of numbness, severe dizziness, or radiating pain in your arms, neck, or jaw. Staying conscious and alert is crucial. If you feel faint, position yourself to avoid injury. When medical help arrives, clearly describe your symptoms, including their intensity, duration, and progression. This information helps responders provide accurate and timely care. Monitoring your condition not only keeps you focused, but ensures you're ready to give vital details, increasing your chances of receiving the best treatment. Stay vigilant, stay safe. Comment active if you are going to try this method out. 10. Plan ahead. Preparation is key when it comes to heart health, especially if you are at risk for a heart attack. Knowing what to do before an emergency occurs can save your life. Start by understanding your risk factors. Conditions like high blood pressure, high cholesterol, diabetes, smoking, obesity, and a sedentary lifestyle increase your chances of a heart attack. Consult a healthcare professional to develop a plan tailored to your needs. Keep your phone charged and ensure emergency numbers are easily accessible. Store aspirin or other prescribed medications in an obvious and reachable location. Share your condition with close friends and family so they're prepared to assist if needed. It's also helpful to identify the nearest hospital and quickest route to get there. Comment ahead if you're going to try this method out. Prevention is just as important as preparation. Maintain a heart-healthy lifestyle by eating a balanced diet rich in fruits, vegetables, lean proteins, and whole grains. Engage in regular physical activity, aim for at least 150 minutes per week, and avoid smoking or excessive alcohol consumption. Managing stress and getting enough sleep are also crucial for heart health. By planning ahead, you'll not only reduce the risk of facing a heart attack, but also be better equipped to act swiftly and effectively if one occurs. Heart health is not just about surviving an emergency, it's about prevention and long-term care. Small changes like a nutrient-rich diet, cutting back on processed foods, and staying active can drastically reduce your risk of a heart attack. If you found this video helpful, don't forget to type yes in the comments and share it with loved ones. Want more tips on living your best life? Don't forget to explore our other videos and hit the subscribe button, click the notification bell, and remember, your journey to a healthier, happier you starts here. Thanks for watching, stay safe, and take care of your heart.